And then health information technology is so critical. Again, I work at the VA, and I know how important health information technology is. So we as a state and then as a country will have to come up with a way of integrating our systems so that at the point of care we're doing what the patient wants, not in terms of just evidence-based guidelines, but also in terms of making sure we're efficient, we're rendering quality, we're looking at cost metrics. I am leading one of the largest accountable care organizations in the state, which is the Atlantic ACO. That has about 55,000 Medicare beneficiaries, has about 1,400 physicians. And you should see how practice trends are changing when physicians have data to tell them where the gaps in care are, or how much the cost of care has been, or the fact that they have no idea that these patients were going in and out of the emergency rooms. And Medicare has been really good about sharing all that data on patients. And so when physicians have all that data at the tips of their fingers, they can truly look at that data and make informed decisions and help with shared decision-making with the patient and the family. So those are going to be extremely critical. One of the things we talked about was the workforce issues, whether it's physicians or nurses. I see a lot of movement right now, and again, we have to lead it here in the state around e-visits. 75% of patients would love to have a video type of conference with their physician for 5 minutes and pay out of pocket versus having to take that time away from their work schedule and have to wait for hours to be seen. So there are insurance companies, and I'm sure Ward will be able to shed some more light on it, that are now looking at paying physicians and nurse practitioners for the e-visits, for the video conferencing consults, for telemedicine, for telemonitoring. So we're going to have to change how we're rendering healthcare to people. Because there is a shortage, the demand's going to go up, but if we don't reposition ourselves to meet those needs and balance what our needs are, we're going to miss the curve, right? So we're going to have to change how we're doing business and reform how we're doing business. You know, one of the most shocking things is, again, as a hospitalist about maybe 10 years ago, there was a certain process that we did discharge planning. So when patients came into the hospital, there was a way by which we sent patients home. There's a protocol that we followed. In the last 10 or 15 years, nothing has changed. So we've done great things in terms of research and breakthrough science and technology and all these great blue chip type interventions. But our healthcare delivery system reform hasn't happened. The way patients are taken care of in the hospitals hasn't changed. The way patients are discharged from the hospitals hasn't changed. So those things haven't changed. So there's a huge opportunity as a result of technologies to start